Assalamu alaikum. I am happy to be here in the third Iraq Derma Congress, and I would like to present my talk about infantile psoriasis, a cross-sectional study in 50 infants. Next. Sorry. As all we know that psoriasis is a chronic disease with relapse and remission, although it may affect any age group, but actually the prevalence of psoriasis usually measured in all age groups as 2% among the general population. But the prevalence of psoriasis in infants only under the 1 year of age is not fully studied. Even in some Iraqi studies done by Dr. Khalil Hamdi, they concentrate on psoriasis in children and infants. But in this study, we concentrate mainly on infants because we notice that many infants less than 1 year of age nowadays are presented with psoriasis. The pathogenesis is very known that it is a multifactorial pathogenesis with interactions between genetics background, immunological abnormalities, and environmental provoking factors. The types of psoriasis are also unknown. We go to our subjects directly. All these types may occur in infants with variable proportions. So we see that the infantile psoriasis, what is the most common type and what is the least common type in patients who are infants. There are only few studies with few case reports of psoriasis in infants that show that the psoriasis usually involve the diaper area, which is called the napkin psoriasis, that may extend to other areas of the body, sometimes involving other flexural areas. This is the most common form of infantile psoriasis, which may be limited to the napkin only, or may extend to other areas of the body or other intertriginous areas. Napkin psoriasis typically seen between the age of 3 to 6 months in infants and may occur earlier in girls than in boys. The flexor and diaper regions, which are prone to friction and trauma, are more commonly affected, and this may represent a form of Koebner phenomenon, which is well known for patients with psoriasis. So we concentrate mainly on the frequency. We want to describe the frequency of psoriasis in infants less than 1 year of age and the clinical patterns of psoriasis in these patients, and study the possible triggering factors for the appearance of psoriasis. It is a cross-sectional study that is conducted in a single center, single hospital in Najaf province, teaching hospital, Al-Sadr teaching hospital. The duration of the study is about 1.5 years. And during 1.5 years, and in a single hospital, we can collect 50 infants with psoriasis. And I think this is a good number, indicate the high prevalence of disease in this age group. Of course, the diagnosis was mainly clinical with the aid of dermatoscopic examination. Any infants with classical representation of psoriasis was included in this study, unless the patients who need biopsy because of difficulty doing biopsy in this age group. Of course, we take history, full history. We concentrate on the birth weight, if there is any relation with the birth weight, type of feeding, presence or absence of family history, if there are any clear triggering factors, and also we try to make a correlation with the mode of delivery of the infant. On examination, we try to find the extension and type of psoriasis in each infant, and we concentrate on the initial site of involvement. Of course, as any dermatological examination, we examine the mucous membranes and the nails. In each case, we make a dermatoscopic examination of the affected areas. We studied the patients and we found that the most common period for the affected or for the age group of the patients is between the 7 and 9 months. But actually more than half of the patients started after the age of 7 months. The disease is more common or slightly more common in female. This goes with the Fabry, who found that the disease infantile psoriasis was more common in male patients. Regarding the birth weight, all patients with infants have normal birth weights. So there is no significant correlation between birth weight and appearance of psoriasis. Mode of delivery, 38 normal vaginal delivery and 12 cesarean section. We don't know the exact correlation with the normal vaginal delivery and if the pressure during passing of the labor canal represent a Koebner phenomena for the infants. There is an interesting findings when we correlate the appearance of infantile psoriasis and type of feeding, and we found that the patients who have bottle feeding, whether alone or combined with the breastfeeding, have more incidence of infantile psoriasis. This actually needs more sophisticated studies to find if the breastfeeding is a preventive measure against the infantile psoriasis. Regarding the clinical representation, napkin psoriasis is almost found in more than 60% of the patients, either alone in 24%, or then show secondary dissemination in 26%, or in combination with other flexural areas, scalp involvement. But we found that the most common presentation in more than 60% is napkin psoriasis. The second common one is the plaque psoriasis, and we see 3 cases of severe pustular psoriasis. We show the picture of these patients at the end of this lecture. Itching was present in 36% of the patients. And itching is more common in patients with napkin psoriasis and pustular psoriasis. Family history, only 10% give family history. And this is interesting findings because in other studies, they found that positive family history in infantile psoriasis was 70%. And even in unusual cases of psoriasis, the family history is usually more. So, in infantile psoriasis, family history is not a necessary presentation or finding. Triggering factors was recorded in 72% of the patients. The mother say that there is definitive triggering factor for the appearance of infantile psoriasis. Among these patients, 26 patients, 72% of them have positive Koebner phenomenon. Chest infection reported in one case, measles in one. After 2 months of measles, the patients get infantile psoriasis. Oral propranolol in one patient, upper respiratory tract infection in 6 patients, and we have 1 patient getting infantile psoriasis in the umbilical area after cautery of umbilical granuloma. This goes with other studies. Nail involvement is almost only 4% of the patients have nail involvement. And this goes with other studies that showed the nail finding was present in 80% of infants and children. Actually, these studies all deal with infants and children, not infants only. So we see nail changes in infants are very, very minimal. Dermoscopy, this is usually we see the usual dermoscopic feature of psoriasis with background of light red edema, presence of the scales, and the presence of regular dotted blood vessels. No characteristic dermoscopic findings. At the end, I will show you some of the photos of the involved infants. These patients have boy with napkin psoriasis. This is 7-month-old infant, also have only solitary napkin psoriasis. This is another infant. Here, in addition to napkin psoriasis, we see more progression to involve wide areas of the body with plaque psoriasis, secondary dissemination of psoriasis. This is more and severe involvement of the infants who is just 8 months of age. This is flexural psoriasis, also a common finding. And this is the dermoscopic examination of this patient. These patients have well-defined plaque psoriasis in the umbilicus after cautery of umbilical granuloma. These patients have psoriasis on the knees when he starts or when she starts to crawl. And surprisingly, the lesions disappear when the patient starts walking. So this is definitely Koebner phenomenon due to friction. This is another perianal. And this infant have follicular psoriasis, which is a rare representation of psoriasis even in adults. This infant have generalized postular psoriasis, very severe presentation. This is the dermoscopy of the dotted blood vessels. Here there is an auspicious sign with the scales. So in conclusion, Nowadays, we see a lot of cases of napkin psoriasis as a real representation or first presentation of infantile psoriasis, and the presentation in infants is more or less similar, but there is variation in the types of psoriasis in infants affected by this disease. And thank you very much for your attention.